beautiful bill Medicaid cuts, I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
First of all, there's so many stupid people that are allowed to vote out here. It's crazy. I've done a video about the big beautiful bill months ago, like I think 7 months ago. So I'm going to link that video to this one so you guys can understand what's in the big beautiful bill. And I predicted this was going to happen.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We have never been uninsured. We're responsible adults. We've raised 2 children. We have always had health insurance for our family, even when it's been expensive. So we have never gone uninsured in our life.
It's crazy. People are voting for these policies that are working against them. It's nuts. These are the ones that have voted for the bill. Now they're complaining. And the other guy that only makes $800, this guy right here. Let's go back to him. This guy right here only makes $800, but the condition that he has is so expensive. It's like $20,000 a month or something. And some of you caregivers that are watching this, some of you nurses, these are some of your patients that are on Medicare. What do you think is going to happen once Medicare cuts this guy off? That means you get cut off too. Like I would say 80%, if not 90% of caregivers out there are relying on patients like these ones. It's a mess. This is why I keep saying, guys, if you're trying to start this business, the home care business, and rely on Medicare, you're in trouble. You're in big trouble.
We're responsible adults. We've raised 2 children. We have always had health insurance for our family, even when it's been expensive. So we have never gone uninsured in our life.
Okay, who cares?
We've looked at, do I need to take a job somewhere that offers benefits? Then how do I help my husband run the business? These are questions that don't have any easy answers.
It's an easy answer. Why did you vote for this? Number one. Number two, you don't have to participate in the system. Why are you forcing things? I've noticed something. There are people that have blind patriotism. They're blind followers. They just follow, even if it doesn't make any sense.
Want to see what happens when you find out the average ambulance bill is $1,200 without insurance, $600 with? He's off, ladies and gentlemen. He is refusing an ambulance ride because of the cost. The problem in America is that our medical costs are so high that without insurance or minimal insurance, you can go broke paying your bills. This is a gentleman who had a shark attached to his arm, and he's refusing medical care because he's worried about the cost. This is a big problem. People are not getting the care they need because they're worried about the cost. And why are things so expensive? Well,
it's crazy. And this is not a functioning healthcare system. This is a failed state. It's a failed healthcare system and a failed state, guys.
One of the main reasons is the ongoing fight between insurance companies and the hospitals. Hospitals will often decide on the price of things, and insurance companies only want to pay a small percentage of it. So let's say a hospital says, we're going to charge $1 for Tylenol. Well, the insurance company may only want to pay 20 cents. The hospital says, well, we need to make more of a profit to keep our business running. So then they charge $2 for a Tylenol. And again, the insurance company is like, well, maybe we're only going to pay 40 cents. And before you know it, after this back and forth, hospitals have raised the price of one Tylenol to $500. And then you come along with minimal insurance or no insurance and show up at the hospital, and they say that'll be $500 for that Tylenol. And that's the problem. It's the ongoing fight between insurance companies and the hospital, and unfortunately, patients are getting stuck in between, and it just has to change.
So health insurance companies are scamming people at their most vulnerable moments, when people are desperate. Do you think this is a functioning healthcare system? As a healthcare worker, this is the system that you're working under. Do you think this system is going to look out for you? No, it's going to use and abuse you. So you need to understand what's really going on here. If you continue on this path where you're working under these conditions, you're going to get burnt out because the system is designed to extract as much labor as possible for as cheap as possible. Slavery. Okay, this is how the United States was built in the first place. Slave labor. So you better learn how not to be a slave.
Republicans did it! Woo, woo, woo! Republicans have finally achieved their goal of canceling Obamacare. They did it, guys. Since 2016, they've been trying to take down Obamacare. They've been trying to repeal the Affordable Care Act. It's after 8 Democratic senators, turncoats, decided to give in, to cave to Republicans. It seems likely that Republicans have finally achieved their goal of repealing the Affordable Care Act. Because
Why do you think this is happening, guys? Why would the opposition party agree to this? It's simple. Because they realize the game is over. Meaning, the government has run out of money, guys. This is why a lot of you guys that keep talking about, you want to get certified to get paid through Medicare, you're wasting your time. You're wasting your time. How are you going to get paid? If Obamacare or Affordable Care Act, let's call it its proper name, if Affordable Care Act is getting canceled, how are you going to get paid? You're not.
be real. Once those subsidies expire and people's premiums double, triple, quadruple in some cases, we already know what's going to happen. Mass cancellation. Everybody's dumping Obamacare.
Hi guys, welcome.
Yep. Go watch this guy's videos. Go subscribe to his channel. In fact, let me subscribe to it right now. Like it. I won't watch the entire video because I want to save this for you guys to go and watch it and get the harsh reality. I talked about this months ago, back in 2025. Filing claims is going to be a nightmare. Getting paid through Medicare is going to be a nightmare. So don't even bother getting paid through the government. Go strictly private pay. Focus on the wealthy clients. The wealthy clients already know this whole thing is a scam anyway. So focus on the wealthy clients that are willing to pay you out of pocket. There are a bunch of other, niches that you guys can focus on. For example, there are a bunch of people that are, in their 70s, the baby boomers that will fly out of the country to places like Turkey, to get surgeries. So for example, hip surgeries or cancer, and then come back to recover in the United States in the comfort of their own homes. Those are the ones that you need to start targeting, guys. Work with those ones and they'll pay you out of pocket. I'll put a link in the description of this video. Schedule some time so I can teach you how to get unstuck. You need to get unstuck so you can get to the next level in the home care business because the game has changed. It's not the economy of Biden. This is a brutal, harsh reality. Hard times are here, guys. And you need to adjust accordingly. Schedule a call. When you schedule a call, I'm going to add you to a private WhatsApp group. And in that group, we're going to hold each other accountable. Link in the description of this video. Talk to you soon.